Good morning, good afternoon, and good evening, everyone, wherever in the world you might be joining us from today. My name is Elena Stavrevska. I'm currently a research officer at the London School of Economics and Political Science, and I will have the pleasure of moderating today's event. The event, as you know, is titled The Gendered and Gendering Aspects of the Pandemic. It is the second in a series of webinars organized by the British Council as part of their Women in Science Resilience platform. We will be organizing 2 more events in February and March, and I hope you will be able to join us then as well. Now, the current pandemic and the management thereof through lockdowns and curfews has shown even more not only the crisis of public health many countries around the world, including those in the Western Balkans, are facing, but also, and relatedly, I would say, the sharp existing inequalities. Around the world, the pandemic has, sort of cracked open, pulled back the curtain, if you will, on existing racialized, class, gendered, and intersectional inequalities. And these have been evident in every domain of life. From the care sector, where in many societies it was assumed that the ability of families, and this usually means women, to provide care in absence of childcare and elderly care facilities was just endless or forever having the ability to stretch endlessly, to the overrepresentation of women in the front lines of in the health sector, to the economy, where those working in the so-called informal economy or informal settings have been hit the hardest and not included in government's responses, often having to choose between ensuring a livelihood or remaining safe and healthy, to the assumption that everyone has a home and every home is a safe one, in that initial response and advice we all received from our governments to stay at home. Now, we have already seen the first studies on focusing on the gendered and gendering impact of the COVID-19 pandemic published, with many not only showing the grim current situation, but also some suggesting this will set back significantly gender equality for decades to come. We have also seen some preliminary results from a rapid gender assessment done by UN Women in the Balkans, but I've also seen some civil society organizations crossing my social media timelines of people doing research on the pandemic. Now, with all of this in mind, today's webinar starts with a curiosity about what the situation has been like in the Western Balkans, as I said, but also how it connects to these global trends. From what I can see, and this is based on anecdotal evidence, I think that many of the global trends we can actually see in the Balkans as well. Today, I have the distinct honor of being joined by 3 speakers, incredible researchers and practitioners and civil society activists working in or on different countries in the region, including Albania, Montenegro, and North Macedonia. So allow me to introduce the speakers. Maja Rajčević is Executive Director of Women's Rights Center in Podgorica, Montenegro. Within the activities of the center, she works directly with women survivors of gender-based violence and discrimination, supporting their protection and access to justice. She runs workshops on gender equality, women's human rights, and violence against women for NGOs, youth, and respective institutions. She was the author of numerous reports and publications on women's human rights and has participated in the preparation of a series of national policies in the field of gender equality and gender-based violence. I'm introducing you in no particular order, although I'll ask the questions in a certain order. Next, we have Dr. Anna Miszkowska-Kajewska, who is a researcher and activist affiliated with the Department of Political Science at the University of Amsterdam. She obtained there a PhD degree in social sciences and a Master of Science degree, cum laude, in sociology and gender studies. Her doctoral dissertation won the 2015 Gender and Politics PhD Prize of the European Consortium for Political Research and was published under the title Feminist Activism at War, Belgrade and Zagreb Feminists in the 1990s. And I strongly recommend the book. The book was nominated for the 2018 Joseph Rothschild Prize in Nationalism and Ethnic Studies. And in addition to feminism, nationalism, and war violence, Anna is interested in civil activism, LGBT issues, peace building, and women's reproductive rights and freedoms. Last but definitely not least, we have Dr. Ermira Danay, who holds a PhD in Human and Social Sciences from the University of, I'm going to mispronounce this, Neuchâtel? No, I'm mispronouncing that, Switzerland. And since 2002, Ermira has co-authored and authored various research reports, books, articles, and other contributions related to gender and feminist studies, with a particular focus on Albania and the Balkans. Her main research interests encompass the examination of gender in communist and post-communist Albania, the feminist activism in post-socialist countries, the gender analysis of migration, of violence against women, of labor market, and so on. Currently, she is an invited lecturer on feminist studies and a visiting researcher at ISCTE IUL in Lisbon. Now, welcome all three of you. But before we get started, let me share a few housekeeping rules, so to say. Today's event is planned to last approximately 90 minutes, with the first 60 or so being dedicated to the speakers addressing the core questions around which the webinar has been organized. And then we'll have 30 minutes for Q&A to engage the audience. The audience members will remain muted throughout the webinar, but you have a chance to ask questions in the chat box, or rather in the Q&A box, which I will then convey to the speakers. So please feel free to write your questions as you think of them, or at the end, whichever way you prefer, directly in the Q&A. I will also kindly ask the speakers to mute their microphones when they're not speaking, so we can prevent any interferences, especially as many of us are calling from home today. Finally, please note, this is a note to everyone, that today's webinar will be recorded. Now, without further ado, let's get started. The first question that I would like to ask for our speakers to reflect on is how women and men, and I apologize for the binary distinction here, in the region have been affected differently by the pandemic and the management thereof. Here I am thinking of the different curfews we've seen, different lockdowns, lockdown measures, and so on. You all have expertise in different areas, so you're welcome to reflect either on your own expertise in a particular area of this broad question, or stick to the broad question as such. Let's start with Maya, and then we'll go to Anna, and then Ermira, if that's okay. Let's keep the questions, the answers, if possible, to like 5 to 7 minutes, so we have sufficient time for Q&A in the end. Maya, the floor is all yours. The virtual floor.
Okay, thank you very much for the invitation. It's a pleasure to be here and to meet you all online. Well, I have to say that my primary work actually is women who are affected by discrimination and domestic violence. And that was one of the first actually insights into effects of pandemic. We realized that women who are suffering domestic violence are exposed to bigger danger due to the lockdown measures. But not only that, it was also the reason for that was also that our institutions worked in limited hours, and also they prosecuted only the most urgent cases. So women actually found themselves in the situation that even when they report violence, they are not getting proper response. So it was quite concerning for us. At the same time, the lockdown measures didn't enable them to go out from home and to seek for help in cases during the lockdown hours. So it was in many aspects very hard situation, and the situation we were not used to before. So that was only one of the aspects of the pandemic. But at the other, when it comes to other fields, let's say, of women's and social life, there were also aspects related, of course, to their employment. So we now have the situation in Montenegro that since the beginning of pandemic till today, we have around 7,000 unemployed women more than we had before. So it really affected also women's ability to exercise their labor rights and to be employed, which also affects, of course, their economic stability and their independence, economic independence, which is also crucial for their fighting from domestic violence. So there are also many aspects, and one that is particularly, I would say, hidden is actually the effect of pandemic of women's unpaid work and their role into the private sphere. I would say that even before the pandemic, we had a situation where women are mostly engaged into the domestic work and unpaid work, economy of care, etc. But in this situation, it's becoming even bigger burden for women, particularly when we know that during the pandemic, the schools are closed. In Montenegro, for example, the kindergartens were closed for very long. And not to mention the situation with the gender segregation of professions, where women are mostly, of course, included into, again, services, health work, on the first line with health as health workers, and also in we know that the first one that were hit by the pandemic were women in supermarkets who worked for long hours without any protection at the very beginning. And I would say that they didn't get any protection until finally civil society raised their voice and said that those women are mostly affected by the risk of pandemics and that they should be protected in a way. So it's very complex, and but there is only, I would say, one positive thing is in our countries, it's very hard to get gender segregated data, although it's also something that is a legal obligation for our institutions. But this situation actually brought to some very important and useful researches in this area. And now we have some data, concrete data about how pandemic hit women harder than men. And I can tell more about it in the continuation of our today's talk. I want to save space for my colleagues.
Great, thank you, Maya. I think that kind of sets the terrain quite widely for because there's so many different aspects in which where our lives are anyways gendered and unfortunately gendering, and there's so many different aspects in which the pandemic has hit and revealed something that we as researchers in this field and people who work in this field have been long aware of. And you're right that we do see a lot more gender segregated data now. And not only, I mean, in terms of what's happening on the ground, but also in terms of everything being moved online. So for the white collar aspect, so to say, we also have more gender available data in terms of in terms of gender as well, because now everything is online, so you can easily gather that data, I think. Okay, Anna, would you like to share your perspective on this question?
Yeah, hi, hello, and thank you also on my behalf. First, I want to say that what I'm going to say during this webinar has not been based on specific research I have conducted, but more generally on my interest in gender inequalities, the gender dimension of different societal phenomenon, and also very soon after the pandemic started, I became then also interested in the gender aspect of this crisis. And already in the introduction, now Elena and now also Maya pointed to many things in the socioeconomic sphere. And now I want, and I also later I'm going also to talk more about the socioeconomic sphere. But at this stage, I would like to say something about the medical sciences and the gender bias in the medical science, which is something which also we who are in social activism, in social sciences, sometimes or often forget to state. And I was inspired to mention this because by reading recently an article which was published in a medical journal, and this article revealed that in the clinical trials which are undertaken around the world, clinical trials for COVID-19, maybe I'll just explain in one. Clinical trial means experimental procedure in which new drugs or combinations of drugs are tested to establish the effects, whether they have an effect in treating a certain disease, whether they have side effects, etc. This was a study of 30 such clinical trials which have been taken around the world. And the team of researchers from Belgium, Germany, Netherlands who undertook this study of these trials, they realized that there was astonishing lack of attention for gender in these clinical trials. And this issue has been so important and striking that it was also recently raised within the European Parliament that there should be more attention for gender. So more concretely, what these researchers found out is that in 29 out of these 30 trials, the results were not controlled for gender. In other words, it was not seen, it was not checked whether the effects in women were different from the effects on men. Also, there was no attention paid to the selection of participants in the trial. It was not ensured that there was an equal amount of women and equal amount of men participating in these trials. And almost 25% of the studies included 2 times more men than women in the trials. So anybody with a basic knowledge of statistics knows that if you do a research on, for example, 100 men and 50 women, and you don't take this difference in quantity into account, the results which you will obtain will say much less about women and much more about men, because there were simply more men in the sample. And because women and men have, and of course, also just like Ellen, I have to apologize. Now we speak in binaries predominantly at this webinar to give the bigger picture. So since women and men have biologically different bodies, are born with biologically different bodies, and throughout the course of the year, their lives, their bodies are differently influenced by the environment, one has to include as many women in the trials, and not including as many women in the trials can have as a consequence that a drug will be tested, it will be approved for use, and then it will be less effective on women or even damaging to women because it was tested predominantly on men. Or in a different way, a drug can be much more useful for women, but they will not have access to it. They will not be given this because the studies, the clinical trials, show that this drug wasn't effective. But again, it wasn't effective on men. And this is also something which we need to keep in mind about not only the drugs which are given in treatment, about the vaccines which are in the process of producing, and also like regularly think about and point to the potential and often existing gender bias.
Yes, thank you, Anna. I think that's a very important aspect that we didn't necessarily consider. Well, I didn't necessarily consider in asking the questions, but it is important, and we see some of the discussions started around with vaccination starting here in the UK, in the US, and well, slowly in the global north and then onward. The questions are being asked whether the vaccines are safe for women who want to get pregnant or women who are pregnant, among other things, because that was not something that was even considered in the clinical trials. So thank you for highlighting this as well, as we are hoping to see the end of the pandemic. Okay, Ermira, onward to you for your take on this first question.
Thank you, Elena, and thank you all for inviting me. And I will focus a little more in the case of Albania, and I will base on some recent studies regarding economic effects and violence against women, and also a very recent study that was done by the LGBT Alliance in Tirana, and it was very interesting. But in order just to emphasize a little bit more what Maya said, and just to give some figures about Albania, it was the same. I mean, it was the same pattern as also in other countries, that there was a rise of the cases of domestic violence. But and I think that is also the case in other countries. In Albania, there was this discrepancy between the number of reports and the police departments or at the other institutions compared to the number of calls at the national helpline. And it's a really, I mean, this discrepancy is like always there, but during the pandemic it was really, really striking. And according to the national helpline, in March there were 30% more calls than last year, and in April 50% more calls than last year. So there is like a visible increase in the number of calls from women victims of violence. So it really showed how unprepared like we are in order to adapt to such crisis. The pandemic this time, it might be another crisis in a couple of years, or I mean, fortunately not, but there will be, I mean, there can be other crises. So that was one thing related to the lockdown. I will talk a little bit later about the unpaid care work, but I mentioned the study from the LGBT Alliance, and there was something really striking there in the same study. So the authors were saying that among the LGBTIQ community, there is this hierarchization, if I could call it, of discrimination. So not all the groups are equally discriminated, and transgender are those who really suffer the most because of being more visible, or and this discrimination was noticed not only by institutions. So transgender is the group with the least of assistance from institutions, but also with a very precarious economic situation, because most of them work as sex workers in order to survive and to have some incomes. It's like, for most of them, it's impossible to find other jobs, so they work as sex workers. So during the pandemic, they could not have this work. So their economic, financial, housing situation was absolutely precarious, and it still continues, but this time of pandemic affected this group the most. So I just wanted to, and I will come again to this survey of LGBTIQ Alliance, because there were some very interesting findings, things that we know. But when you have also the figures coming from studies, it's like more visible and to discuss about them. So I'm just leaving time to the other questions.
Yes, yeah, and thank you, Admira. I think that's another very important aspect, because because you move us a little bit beyond the binary that we've been using, well, that the world has unfortunately been using, and you shed light on another thing that has by and large been invisible, or invisibilized rather, in the public discourse, not just in the countries of the region, but in the whole pandemic altogether. Okay, the second question is related to the first one, but kind of slightly zoomed out, if you will. What gender inequalities do you think, in your opinion or your experience, has the current crisis, or actually multiple crises, overlapping crises, revealed? So not just COVID as a crisis, but you can think of it also as a crisis of late capitalism, or crisis of public health, healthcare, and so on. Now let's start with Anna, so that everyone gets a chance to not speak first, or speak first.
So I would also like what Maya also underlined, this difference between paid and unpaid work. I see it also as one of the consequences of this pandemic, that also that it put the burden of unpaid work on women increased. But hopefully there will be also more and more awareness about this work, which is not only underpaid but also undervalued, and it's also I want to make the point that women who perform care duties at home, who take care of children, of elderly, they also work. Very often we hear around us that these women don't work. They work, but they don't get any financial compensation for their services. So I think that we cannot repeat that often enough, because all around we hear that unjust construction. So what we had with the paid work, which with women performed, some of it continued outside of the home. Women had to live outside the home. Some was partially or fully transferred to the home environment. Women continued to work from home. Speaking about the paid employment, and some of it was discontinued temporarily or permanently. And what we also see that some of the women who remained employed, their workload increased, but not necessarily the compensation they get for it. And we can think here about medical professionals who have to treat more patients while having also more sick colleagues, but also because of having to deal with more complex clinical pictures, medical conditions, and also having to perform a more complex protocols to prevent the further spread of the virus. There's also increase in the work done by educators, who all of a sudden have to, in many cases, have to learn how to use new technologies, have to obtain also to find ways to obtain equipment and a good internet access. And also provide detailed explanations to students and pupils in general, like really learn a new way of working. Or in situations when there is a physical education, there are situations when there is a reduction of the class, so there are less students, but then the teachers have to repeatedly teach the same topic, which also leads to an increase of their labor. But at the same time, we have women whose work was discontinued, like tourist agents, and also even more precariously, women who perform domestic services in other people's homes. And I think here of women who clean houses, babysit, provide elderly or provide elderly care for others. And in many cases, they could not go to work because of lockdowns, because of the fear. Their employers were afraid that an outside person would bring the virus in their homes. Also cases when employers lose or have their income decreased, so they cannot afford anymore having an outside help. Or also situation when having a lockdown and having everybody at home means that the homes already become very crowded, and there is not also enough space, physical space, to host to have the person, even if it contributes to the cleaning, to the domestic tasks. And these women, the domestic workers, are especially also in a precarious position, because very often they are, more often than not, they're part of the informal economy. And once they lose their jobs, or they have their work reduced, they cannot, they do not have access to other income, to social benefits. They don't have an access to healthcare in case they get sick, and they're also even less protected than other people. I mean, in the Western Balkans, and also more generally, there is a decrease in workers' rights in general. So even those who are officially employed have less and less benefits, and that is even worse in case of those who are unofficially employed. So in general, here is also obvious. I want to make the point that although we will speak about women and men in general, that we also have to take to keep in mind that in addition to have people who don't fit the categories, the binaries, the transgender persons. We also have distinction within the categories, which that is not all women are not in the same position. Some women are better off economically. Some women have children or elderly people to take care of. Sometimes these children or the elderly are sick or have disabilities, which is an additional burden. So there are various types of types. There are various burdens which women have to deal with, and what is here important to note also is that various research that even prior to the pandemic's domestic responsibilities remain predominantly a women's task. And I found the data from IGET, that's the European Institute for Gender Equality. That's an EU institute doing research policies regarding gender equality, and they state that even before the pandemic, women in the EU spent 13 hours. That's almost 2 full working days. So 13 hours more than men every week on unpaid care and housework, and we can only imagine. While we wait for more current data, what means in a context of having everybody at home, which means having to cook and clean more. It was already mentioned closed kindergartens, the chances of having a sick family member to take care of, it's also increases in times of pandemic. School children might need additional assistance with their homeworks and classes, which is also, again, one of the things we is more often performed by women rather than by men. So I'll stop at this point.
Yes, I'm also mindful of time. I know Ermira will have to go in 14 minutes, and we will also have one more question to go. But yes, thank you for pointing out to this further blurring of, I mean, we as feminists and people working in gender, well, on gender equality, have always emphasized this notion that the public and the private are not distinct. And I think the pandemic has even further emphasized how very interwoven, how we cannot analyze one without the other, how by separating them we further marginalize the needs, the lived experiences, and even the agencies of those who predominantly work in the home. I think, Ermira, you also wanted to make a similar connections to domestic care workers as well, right? Or not for this question, I don't know, but I know that you wanted to make some points in relation to that.
I mean, it's what Anna said, and I'm not going to repeat because it's the same situation. So the domestic care sector, it's almost informal. And what we saw during this pandemic, it was especially this, so that many states are allowing this kind of informality because people can have some income, so they are not just a burden for the institution, they can survive by themselves and it's fine. And during this pandemic, we saw that, this is not normal. I mean, if I can call it normal at all, to have all these sectors in informality, and some income per month it's not enough. So, so I'm not going to repeat what Anna said. I just wanted to say something from a survey that was done in Albania about how, if parents were in front of this choice, who is gonna cut out the working time, or who is gonna work from home. And from this survey, 51% of employed women worked from home, and only 25% of employed men worked from home. And when it was about those self-employed, the majority of those who reduced their working time in order to care about house and children, etc., it was again women. So, I mean, this was something that we knew. But this pandemic accentuated really how unequal it's the division of labor, and so how women are still considered as the carers. So, I thank Anna for emphasizing that even within women, we have kind of hierarchies. So it's just like, it's important to mention it. And I'm just taking 30 seconds to mention something else that it was noticed in Albania. It was about LGBTIQ community again. We talk so much about students now that the lockdown and the pandemic affected them so much, young people that are living in precarious housing, etc. So they had to go back to live with their parents. For LGBTIQ people, that was even more difficult, because for some of them, parents had no idea that they were gay or lesbian, etc. So can you imagine, like, the conflicts and the pressures? And for some others, they had no relationship anymore with parents because of their sexual orientation. So the survey that I mentioned shows how how it was a kind of increasing of conflict and on psychological pressure to young people of LGBTIQ community because of the housing difficulties.
Thank you. No, that's such an important point. I mean, it relates to something that Maya was saying as well, this assumption that the home, well, that everyone has a home to go to, and that the home is a safe place, whatever that means, whether physically, emotionally, verbally, and so on, but that a home is a safe place. So thank you for highlighting that aspect as well. Maya?
Yes, I can also tell something about the home being or not being the safe place. Well, our experience during the pandemics actually showed the increase in number of reported cases. Actually, all women NGOs in Montenegro, which are not that numerous, recorded a significant increase in the number of reported cases. It's from 20 to 30%, actually more reports than it was before. But I would say that actually the burden that was somehow put on common women through the pandemics was reflected also by the work of women in civil society organizations, particularly those like the one I'm representing, who are working in the support services. So I would say that we actually have a much bigger work overload than we had before. And somehow we are trying actually to make everything going on as usual, but it's really very, very difficult. And it put a lot of pressure also to women NGOs that had to provide even more broad services than before. They need to be more accessible than before. Many of us actually had new hotlines for women that they can report to. And with the same, I would say exactly the same amount of funding that we usually have. So it's actually, it shows how the burdens on common women is reflected also on us. And then at the same time, a lot of our beneficiaries faced a huge risk of poverty and actually the real poverty, because many of them were employed in the informal economy. And women were the first to be fired during the time of pandemic. So many of them actually who are even, the pandemic actually made really, really visible and even more adverse the inequalities between women and men, and particularly when it comes to poverty. We had in Montenegro, and I'm sure in other countries, because I'm also collaborating with many women NGOs in the region, there are many self-supporting parents, women self-supporting parents that are actually living alone with their children, and their ability to obtain alimony in our countries was already very difficult. And during the pandemic, it became more difficult, even because many of their partners, ex-partners or fathers of their children remained out of work, or they had different excuses for not paying the alimony on time. The courts were working in much less capacity than before, so the execution of court measures was also very difficult. So it's actually hitting women on many different grounds. And what is also interesting for us was to listen to see how the government measures are actually taking into consideration the unequal position of women and men, particularly women from vulnerable groups like Roma women that are totally excluded from every support, actually, because most of the government support were actually economic measures for helping economy survive, and they usually were the packages of incentives for entrepreneurs, etc. And we know that most of Roma women, but also I can mention LGBT women, women with disability are not working, and these measures never ever take into consideration their position, actually. Again, in general, government's measures were gender blind, and again, I have to repeat that there is a legal obligation for all of our countries to do gender analysis and to do gender mainstreaming of each measures and policies, but it didn't happen. And not only already brought measures were gender blind, that didn't take into consideration different positions of women and men, but some of them were really discriminatory. And I have the example to share. Just we have a new government now, but the previous government left their positions like 10 days ago. And before they left their position, they actually decided to direct 700,000 euros that were intended for human papilloma virus vaccine to vaccine for ordinary flu. So they took from the budget that was intended for that, and this vaccine needed to be implemented till the end of 2019. So they were already late, and now it's very uncertain whether they are going to have the vaccination against HPV or not, because they took all that very big amount of money, and they will spend it for the ordinary flu vaccine and for some medical staff equipment. And we have the situation in our country that healthcare is not that accessible again for common women, not to mention again women from vulnerable groups. Even if they decided that it's not that they don't have capacities for this vaccine at the moment, they could have actually direct this money for some other health services for women. But it's a matter of discrimination, and in this case, I would say it's structural discrimination, which even needs to be maybe taken in front of some international bodies that are dealing with discrimination, such as CEDAW committee. So we have actually the whole situation actually just reflected the very adverse position of women in our region and the huge differences and inequalities that are already present.
Yes, thank you, Maya. I mean, the issue of funding is something that I want us to return to later on, both for NGOs, but in terms of public funding as well. Again, mindful of time, the third and last question is, what, in light of everything that we've discussed so far and things we haven't managed to discuss yet, what do you foresee to be the gendering consequences of this pandemic? So kind of thinking more long term, not just until we get the vaccine, even though the vaccine for all of us might be for way further down the line. Ermira, first I'll go to you, because I know you have to leave, and then we'll continue talking with Anna and Maya.
Thank you very much, and I'm really sorry that I have to leave, and because there are so many things that we can say about these issues. I mean, for the last question, I'm kind of an optimistic person in general, but not when it comes to gender issues, because I don't know. So. Unfortunately, so I mean, I'm optimistic in the sense that it was not because of the pandemic that we had this situation. So it was even before. It was a little bit more clear to our eyes what happened. And I remember when I was living in Lisbon, there was this graffiti that during the economic crisis, and it was saying it's not the crisis, it's capitalism. So now I would say it's not pandemic, but it's patriarchy and greed. So this pandemic showed us that we need social safety nets, like the welfare state that they are saying to us that it's not good, we have to cut public funds, etc., in order to develop. That's not true. We need welfare states. We need the public health care system. We need unions in order for people not to work without contracts and in precarious situation. And I think gender is everywhere. So I'm not focusing just on women and men or on the situation of women, but in all the parts of our society. I mean, we really need to rethink about the welfare state and the social safety net. So that's what I would say. And I'm very sorry that I have to leave. I'm extremely sorry. So, and I thank you, Elena, for keeping time so you can allow me to leave in time. And thank you very much. And I mean, I'm sure the continuation will be great of the panel. Thank you very much.
Thank you so much, Mira. Thank you for joining us and for sharing your insights. We'll continue talking about some of them after you leave. Good luck with everything you need to finish today.
Thank you. Bye.
Maya, bye. Maya, shall we go to you, and then Anna can wrap it up in the end?
Yeah. Well, related to your question about the consequences, well, it's obviously very clear that this pandemic will have adverse effects on, of course, women and men. And again, I also have to apologize for always using this binary division, but also on quality of life of people in general. But I'm really trying to focus a bit on something more positive, which is not very easy, but at least, as I mentioned, it is obvious that this adverse position of women will definitely have bigger effects on our societies. So we have those researches that for the first time, actually, at least in my country, are bringing issues that were not somehow part of the public dialogue. They were not even the part that much, I can freely say, of dialogue proposed by women's civil society organizations, like this, what we were talking about, unpaid work and unpaid care that women are undertaking. Somehow we are stuck somewhere in the second wave of feminism, talking about public sphere, not that much about private life. So we have now the data, at least, that are really showing how big burden on women was. And I will just share with you the recent data from the UNDP research that said that estimated monetary equivalent of unpaid care and domestic work for 3 months of the beginning of pandemics was 122.3 million for women and 63.5 million for men. So it means actually that work done by women in the domain of unpaid care and domestic work exceeded that done by men by 92%. So this is the data we never had before. I mean, we knew about it. It was like something really common, but at least we have it in written. We have data that are showing this. So from us, one aspect is that we now have the data that we can work with and that we can always raise this topic in public. But at the same time, there are other things that actually were showing how our institutions, for example, can be really efficient when it comes to breaking of the measures against pandemic, and we now actually call upon them to be efficient in the same way when it comes to violence against women. So that was actually our first response to this crisis, when we saw how our prosecution offices are actually very, very quick when it comes to breaking the measures against pandemics. So people were very quickly prosecuted, etc. At the same time, they were not reacted in cases of breaking protection orders for women. So now we use this example actually to claim the same for victims of gender-based violence. So that's one, again, thing that we are using at this moment that maybe might be considered a bit of positive effect of the pandemic. But of course, there are many other issues that are not that positive. And I will completely confirm what what other colleagues said about having social security measures, having the welfare state as something that is really, really important in these very difficult times.
Thank you, Maya. I think that's a very innovative way of thinking, because like we've seen responses of how curfews and lockdowns have limited people's liberties and freedoms and whatnot. Then we've seen, on the other hand, this I would say advocacy for stronger measures, so this continuous, I would say, kind of tiptoeing between collective responsibility and individual or individualized responsibility. But we haven't necessarily seen the issue of suggesting if you can actually be this effective with other things, can we not see that in areas where that's much needed, really? So I think that's a very important aspect to engaging with institutions in this response. Anna, onward to you.
Yeah, maybe it would have been better if I was second and Maya was came after me, because she showed this silver lining. And currently, unfortunately, I'm in a, similarly to Ermira, I'm in a more pessimistic mode, which so it's also for me good to be reminded of the existence of creativity and resistance, and also I had to think about this proverb: fall 8 times, stand up 9, of like never give up. But let me give pay respect to my pessimistic prognosis. So I'm really worried about the health and well-being of women. And I will say several things which I came up with. So I'm worried about the exacerbation of the existing diseases, because women will not have the time or the money to go to a doctor. We also have to keep in mind here the fact that the public health institutions are mainly now focused on treating the COVID-19 patients, which also means that it's very much more difficult, close to impossible, to schedule a checkup if you have cancer, heart disease, or another serious condition. And even when it is possible to have a checkup, the waiting lists are much longer, and we know that the time matters in such situations, and this can lead to serious conditions being left untreated for much longer time, leading to much more serious consequences. And also the sociological, this very gender component about how women are raised to put the needs of the everybody else first, rather than their own needs. So women might postpone the visit to the doctor also because they have to take care of a sick member, because they have to get one more formal job to pay to earn some. So besides the exacerbation of the existing conditions and diseases, I'm also worried about the development of new ones, including burnout, very serious condition which is still in our region, the Western Balkans, is still not seen as a serious thing, is seen as somebody being just playing a victim. And so I'm also worried about a higher mortality rate, what the increased exposure to domestic violence will mean, both for the physical and the mental health, consequences of a decrease of income and job loss. And also, we also have to mention here the access to abortion and contraceptives. What does this mean if we have now indicators showing that this access is reduced? So what does it mean to in such a severe condition to become to be pregnant without proper health care? What does it mean to give birth to an unwanted child? What does it mean to not be able to receive access to legal and safe abortion, and have to go to clandestine abortion, which might not necessarily be safe, and more often than not will be very expensive. So again, the question of affordability. And also, just to return to the point which I made at the beginning, I'm also worried, and which also then Elena mentioned, about the consequences of the vaccine potential on pregnant women. I'm also worried about what if drugs and vaccines are not tested properly, on women, what the consequences will be on their health. And another aspect, and maybe then. Not to speak too much, I will close for the time being with this. I'm also worried about the advancement of women in their careers, how they will be able to develop professionally, and I expect that there will be a decrease in the career advancement of women, and not only because of decreased health, decreased well-being, but also because of being unable to to produce all the requirements. Like in the academia, for example, it's very important to have articles published. And what if you are unable to write, as studies have indeed shown that women are indeed submitting much fewer articles since the pandemic. So because of domestic duties, one has to think, because of improper working conditions, one has to think also about how many women have a room of their own. Virginia Woolf was already discussing that, how the importance of having a room of one's own, and in our days, the importance of having a laptop of your own and a good internet connection of your own. And also, I expect that women will reduce their participation in voluntary activities, and one has to think here about various charities, shelters. Maya mentioned some of these things. Soup kitchens, but also then in the more political domain, like in public debates, and even like in webinars like this one, which all the kinds of work which has to be done in addition to everything else, and usually is not being paid. So, and I also then in the long run, I expect that our countries will become even less democratic because women will have less energy, time, willingness to participate in the political process.
Yes, that is somewhat gloomy, but I don't disagree with the assessment, but it is, I will ask you at the end, if you can think of one positive thing. That's how we will end today. But before that, I mean, thank you very much. You have provided so much food for thought. And even though we didn't necessarily speak about this beforehand, each of your answers kind of spoke to one another, all three of you. So that's very much appreciated and kind of built on each other. I have many questions of my own, but we have 2 questions in the Q&A chat now. And let me also encourage the audience to ask any questions they might have. So I'll start with Jelena Milinovic's comment and then question. She writes, I'm aware of the backlash on women's human rights and gender equality in recent years, which has arisen as a political process by authoritarian regimes connected with religious leaders. The crisis of the neoliberal model of capitalism and the current pandemic show that human and natural resources have almost collapsed, and that it is very difficult to expect things not to get worse in such condition. I fear the gender roles and the gender division of labor will be even more cemented. What is your opinion? So this is a specific, I mean, we spoke about this in kind of different aspects already. I think Anna, well, both Anna and Maya spoke of the gender division of labor. But if you could maybe also tie that to other ongoing processes, not just the pandemic, but processes of, we've seen such a big global pushback against women's rights. We've seen, well, not in the current, in the countries in the current governments of North Macedonia and Montenegro, but we've seen in the region as well massive pushback against women's rights, against things that were guaranteed in the Yugoslav times, against things that we kind of took as granted. So if you could briefly reflect on this.
Well, I fully agree with this said comment, and yes, it is very much difficult. Also, very much also related to the resources we had, and in particular in Montenegro, we had a situation where the resources were misused by the political elites actually for many years, and it of course reflected the position of women in our societies. And when it comes to the general backlash of women's rights, yes, there is a common trend throughout Europe where we have much bigger influence of religious groups, and it didn't miss Montenegro as well, because we now have actually the new government, which came into power mostly thanks to the huge support by the church. And since the situation in our countries with very low living standards and poverty is on the rise, I guess that it will also in a way, that's how historically actually happened, in a way also strengthen the role of the church and religion in our societies. And some of the consequences of that are already quite low. And what else to say except that I agree actually totally with this comment. And what the pandemic also showed is that, for example, women in civil society were very much involved also in protection of natural resources. And now more than ever, it came into picture that how important actually it is, and how misused our national resources are, and how women were not at all consulted in those processes and policies which were made related to our natural resources.
Thank you, Maya. Anna, do you have any reflections on this?
Well, this is like the big question: how do you bring about the positive social change, a change which you deem, of course, positive? There is no consensus about that, and it is also one of the problems about bringing about a social change. But let's and then now I will step more. I will call the positive, the activists, we never give up, Anna, for help. Despite the gloominess, despite bad prognosis, it also remains the fact that we can never know for sure when and how a change can also a positive change. Sometimes we have women work or activists work for many years on a certain issue, and then something happens and it is all of a sudden possible to get the women to vote, or to have recognition of same-sex partners, to have even the possibility of have a legal sex change in North Macedonia in a document of a trans person, something which I wouldn't have thought would be possible in many more years to come. So despite the gloominess, the lack of resources, all of us walking on the edge of burnout, and all these things having to deal with domestic violence and all kinds of violence around us. I think it is also important never to lose sight of also the resources which we'll still have, the networks which we still have, the networks which we can build. The pandemic also showed that we can do much more online than what we deem possible, that we can have also much more of our private lives and connections. We can continue them online. So this is would be a very general thing, and it's also it's not bad to say it generally, because everybody will then find for themselves in their own environment, their own networks, resources, which you can change in your personal, private life, professional work life, And one of the first things is to discuss issues. It's like things will never change by themselves, and the time will never be right. We have to set things in motion to make the time right.
I like this activist Anna being positive and thinking of how we can move forward from this. And there's a question about this, but I'll keep it in the Q&A, but I'll keep that for the end. I'll go to another question now, which asks, I mean, to contextualize the question a bit, and I hope I'm doing it justice. We have seen the global hierarchies of care even more exposed, in the global movement of care workers even more exposed during the pandemic. For instance, while Germany was in lockdown, there was no problem for it to allow for trains filled with Romanian and Bulgarian care workers to arrive. Also related to the kind of conditions in which they lived and so on, and not just health workers, but actually also workers that picked produce and vegetables and fruits and so on. I mean, here in the UK, I know that many Bulgarians were brought in on special flights to help with picking of strawberries, without necessarily being provided personal protection equipment and so on. But with that in mind, or maybe not even with that in mind, the question is if we can comment on the problem of people escaping Western Balkan countries after pandemic because of poverty from gender perspective. So taking into consideration the current context, I think, and what has been a trend from the region for decades, well, a couple of decades now, but also thinking forward of the way, as we've spoken, that the pandemic economically will hit, or rather than an economic crisis will inevitably follow the pandemic. If we can also think of people on the move and migration processes in the aftermath of whatever the aftermath means here. I don't know when, like, whether there's a clear line or where it begins or where it ends, but in the aftermath of this from a gender perspective, if that makes sense. Whoever, I mean, there's only two of you, so whoever wants to start can start.
Well, I mentioned something about poverty already, and it is obvious that it's going to strike hard after. It's already striking hard, and it's going to be striking even harder. We already had not very successful economics here, and it's similar again in the whole Western Balkan region. And actually the government measures proven to be inefficient when it comes to protecting individual rights of workers, and particularly protecting women from being fired during the pandemics. And it's already obvious that it's going to be very difficult times. And in this situation, somehow, again, I would say that civil society is undertaking the role of state institutions when it comes to taking care of people who are in the very adverse life situations, dealing with poverty, etc. So we have a certain, what is also positive, and I guess I'm somehow used to try to find something good, although it's not easy, I have to say. There is that sense of solidarity that somehow appeared a bit more during these times, and we have very different initiatives. Some that came that were not organized, that came from citizens that were dealing with supporting their neighbors or other citizens that are facing poverty, etc. But of course, it's not the answer to this question. It's something that is actually that is a sort of a situation, and that is requiring some urgent actions, but it's not something sustainable, of course. And there is, of course, we need to have awareness on the higher levels of our institution on this, that is going to happen. And in general, the problem of migration from the people from the Balkan region was a problem, and I'm sure it's going to be even bigger in the future. And this, of course, needs to be the part of specific dialogue with the state institutions, and something that needs to be discussed on the higher levels in our society, in our state, actually.
Thank you, Maya. I mean, we've already seen, and this was before the pandemic, projections that the region will be emptied out almost of healthcare workers in a couple, not by the end of the decade, because of being undervalued, overworked, underpaid, and so on, which the pandemic has exposed even further. So I think that we'll also see in particular sectors stronger movement than, I mean, if it's possible, a stronger movement, but stronger movement than what we had seen before as well. Anna.
Yeah, again, yeah, the gloomy prognosis. Yeah. Despite this, in addition, not despite, in addition to this, to the brain drain, basically the body drain from bodies drain from the Balkans, it's also it remains a question. Once a person emigrates, how easy it will be for them to find a legal employment, because we can also expect, if because of if countries enter recession, with refugees and refugee flows, but also increase of xenophobia, of intolerance. How what the procedures will be to find proper legal work as an immigrant outside of the not having an EU passport, and what will then also mean for people who will end up in these precarious jobs without hardly any security. And we already knew that women very often, when they go in Western countries, they, besides being care workers, like in hospital, elderly people homes, they also work, then already worked informally, taking care of elderly people, for example. That is a very common example in Croatia and Istria, women going to Italy, also when women going from Romania to Western countries, from Slovakia. And so what will then, if you think that we already have women who were in precarious position, without access to proper health care, exhausted, close to burnout, already having gone through one or two burnouts, what will additionally then happen to them once they have to emigrate? What I also see as a possibility, a possible development, is that many of us will have to reschool, basically change professions, because rather severe. If we think that there is less and less money for social sciences, and now with the pandemic, we also see that the accent goes investments in the medical sciences, and there is much less funds to explore the social consequences of the pandemic, something you need social scientists for. So I can imagine that many of us who are in this field of social and which also means that there will be also further gaps in the knowledge on these specific issues, which are only targeted or understood in depth by social sciences.
Thank you, Anna. And actually, this brings me to one of my questions that I mentioned earlier, to something Maya was saying about funding. Maya, I mean, you work in the NGO sector, so I would like to hear your reflection. And Anna, of course, if you're familiar with this, your reflections too. Anecdotal evidence, or from what I've heard from people working in the sector in the region, a lot of funds from donors, so which have been the bloodline for many NGOs, because often funding is not available through other sources from public institutions and so on. So a lot of the funds that otherwise would be directed towards gender equality or exploration or support of women's issues as well as funds for other funding lines, have been redirected towards COVID-specific issues, which have not necessarily been gender aware or gender sensitized. What has been your experience? I mean, like, can we also talk about, yes, social scientists will probably, and especially in the region, will probably end up with a lot less funding in the aftermath of the crisis. But I would also like to reflect a little bit on the situation with the NGO sector, which has been, as both Ermira, I mean, all three of you really mentioned, has been the provider of services that by and large the states have not been able to provide, not just to LGBTQI people, to victims of sexual and gender-based violence, and so on and so forth. They have also been the primary advocates for gender equality and for highlighting these issues. So if we could reflect a little bit on that as well, please.
Well, we already have some announcements that EU funding will be more focused on tackling the effects of the pandemic, where the gender dimension of this funding will be a bit blurred with the current happenings. And for my organization in particular, we already had the funding for this year, but for what will happen when the pandemic started? But what will happen in the future, it's going to be, again, very uncertain, because we do expect that most of the funding, particularly EU funding, that is the most important funding for the civil society in our region, will be more focused on pandemic effects. Also, what we noticed, many of our organizations are actually needed funding to direct support of our beneficiaries, and that is something that was not very, it was not the priority even before the pandemic. For example, when I say direct support, I think not only about providing legal representation, legal aid, psychological support, for example, but also other sources, like, for example, providing for food, hygiene, for providing for really basic necessities for those women who are remained out of work, who worked in an informal economy, were not secured at all. And in this situation, the state didn't appear to be very efficient in because the whole structure of social welfare was not prepared for this, and it was already quite unjust and gender blind even before the pandemics, and now it really became quite obvious. So beside our regular work, we actually tried to focus also on how we can provide some direct support to our beneficiaries, and we were trying to get food, hygiene packages and that kind of stuff from the donors, but it is very difficult because it's perceived always that kind of support is not sustainable, that it's something that should be done by the state and ensured by the state. And for that reason, it's very hard, I mean, to explain to women that you cannot help them with some really basic needs, but you can provide advocacy, for example, for their rights, etc. So I think that in the future, all the major donors should also focus on some really very basic needs of people in this region, particularly, again, women and women from vulnerable groups, because when somebody is focused on pure survival, then I'm not sure it's able to actually think wider on the human rights and to fight discrimination, definitely.
Yes, exactly. We cannot, as they say, we cannot eat the products of advocacy.
Yes.
Well, not in the short term, yes. Anyway. We do need the bodies, in order to be able to do the advocacy. Anna, I don't know if you have any insights on this question. I mean, I know that your work is elsewhere, but I don't know if you've come across anything or if there's any insights you want to share.
Yeah, I just a short comment. It's very good what Maya, you pointed to both aspects of when you're a social activist, of the forms of social activism, and one is offering direct support because we have bodies which need to be fed, taken care of, etc. And at the same time, there is also this frustration that without knowledge, without systemic change, you cannot satisfy everybody's basic needs, even more so in a context when there is less and less funding for it. And also sometimes among social activists, I have the feeling that we can forget the importance of both aspects, that all of us are needed, and those who are highly better placed in societal hierarchies, so have more access, are more able to lobby, to advocate for certain changes, not only among the local government, but also among the funders or European Union politicians, and also the people who are then more in contact. And I don't make a dichotomy. Sometimes people perform both types of activities, but also, and this other type of activity being having a good network, performing grassroots work and offering direct. And this reminds me also, and this is like a link to my other work, all of a sudden I had to think about the wars, the post-Yugoslav wars, and how the Belgrade and Zagreb feminist activists, whom I did analysis of, they at the same time, they provided, they worked directly with women who were raped, they offered psychosocial assistance, they distributed humanitarian aid, and at the same time they also traveled abroad, spoke in foreign media, and tried to inform the general public, European politicians, US politicians, about the importance to criminalize war rape, to put an end to war rape. So this is something which, yeah, both aspects are needed. And we also, so it's a call also for us social activists to support each other more.
Yes, excellent. And this actually leads me to the last question for today. We have about 10 minutes. And there have been questions in the Q&A, which I hope I will do justice to. But basically, could we, moving forward, knowing what we now know, perhaps some of the things we didn't know the extent of back in March when most of our countries were hit, what are the immediate strategies? What can we do? What can we do as activists, as NGOs, as researchers, as human beings, as gender equality advocates? What can we do in the immediate and the sort of longer term response, or longer term gender aware response, gender equal approach to responding to this and similar crisis? What can we do better? And if you can think of one thing that we've done, well, not me, but you, the society or NGOs or movements that we've done well in response to the pandemic, let's also highlight that, just so that we share some positive responses.
Well, I can share that what we, the attempts to do whatever we can almost brought us to burnout. So thanks, Anna, for mentioning that. It's really strange how women always somehow take the burden of everything that is going on in the society. So I think that actually what you also mentioned, Anna, that sense of solidarity in the region among women's groups that was very visible after in post-war period in ex-Yugoslavia is something that somehow also is connecting us even today. So these are the issues we are actually discussing among ourselves in the Western Balkans Women's Civil Society and talk a lot. But also what showed us is that the matter of intersectionality is something that we didn't, let's say, discuss enough, and that somehow our activism actually left some vulnerable groups behind. So I think that this is also, again, the opportunity for us to reflect on our work and how better we can connect among each other, how better we can include it, not only organizations that we are used to, women organizations, but also other organizations dealing with other communities. So that's one of the way actually how we can work better. And I think it's very important because it's something that we are not discussing quite often among ourselves, usually because of the huge burden that we are facing at this moment exactly in trying to handle the situation in the best possible way. And another important issue is the issue of burnout. I think that this should also taught us to take better care about ourselves as well, and somehow to actually have some reflection on how we can actually be healthier, actually, because in this job and in general, being raised as a woman in Western Balkans, where gender roles are so strong, we are taught not to take that much care about ourselves, to care more about others. And I think this is maybe the time of the crisis that we should use also to think about ourselves a bit more than before.
Yes, indeed. Self-care is
and
becoming
to encourage
even more...
each other actually to take care about each other, to take care about self more.
Yeah, indeed. I mean, self-care is becoming even more of a radical act in the current context. Thank you very much, Maya. I mean, you're pointing to some things that perhaps do not seem obvious to people who are outside the civil society sector and who do not necessarily see. I mean, there's been quite a few publications coming out now from joint projects of women's organizations around, well, not just women's organizations, organizations dealing with gender equality more broadly in the region. And there's so much we can learn from each other and support each other in doing this. And thank you also for raising the issue of intersectionality. We have mentioned Roma women, you mentioned earlier women with disabilities, we've mentioned LGBTQI people and so on. But yes, putting it front and center in terms of collaborating is something that's massively important. Anna, no pressure of time, but we have 5 minutes left. Wait, you're muted. You're muted.
I wanted to say no pressure, but only 5 minutes, no pressure, but you have to say women have to save the world. It's indeed, no, we indeed, yeah, it's like what Maya was saying, the importance of self-care, this awareness that we need to take care of ourselves, and also, and so this is, I have to, one of the things I mention very often, this image which many of us are very familiar with in a plane, when you're advised to put the oxygen mask, you are first advised to put it on yourself and then to put it on a child or somebody else who is not capable of doing it by themselves. So this is an excellent metaphor that we have also to keep struggling to also satisfy our basic needs, to remain sane, to remain healthy, because the system is not very likely to protect us. But for the positive, then other positive things is that are the accumulation that we increasingly accumulate knowledge. Like the pandemic hardly started, there were already many feminists and gender scholars who were saying, watch out, we'll have a problem of domestic violence. Domestic violence will increase. And unfortunately, that happened. Indeed, fortunately, in this situation is that there is already knowledge which can hopefully then also help in the future to detect and prevent negative social phenomenon earlier in the process, or earlier start advocating for more funds. Even not more funds, but asking governments not and funders not to cut the existing funds, which have already been initially earmarked for women's groups and shelters. And the other positive things which we have seen are the great exchange of knowledge. We are such webinars, online lectures, which technology has provided, and in this sense has also benefited women who cannot afford to go abroad to a conference, to pay the conference fee, the plane ticket, or also who do not have the right to enter a certain country because of having to obtain visa or being without a passport, being stateless. So there are certain, there also have been positive developments, also solidarity actions of collecting money at local level to immediately assist people. So basically, maybe a good way is to congratulate ourselves on the good work we have done so far, and also think of what else we can do, but without having the idea that we can save the world. We can contribute to saving the world, to making the world a better place, but it's not only up to us. We need more partners. We need more partners also among men of different strata, to include the intersectional component.
Absolutely, and I think that's a very good way of wrapping up today's discussion. I think I want to thank you both, and Ermira, so much for sharing your knowledge, your time, your energy in a already quite intense wrapping up of the year. I hope our audience has also benefited as much as I have and enjoyed this discussion. Thank you to the audience for joining us and for asking such good questions. Sorry that we didn't manage to go through all of them, but I hope that at least we touched on quite a few of them. And I hope that we will have more, not just discussions like this, but for products in the public domain, in the public policy that reflect these discussions further, and that they're not limited to just women or to just certain strata of women. So with that, thank you again. I wish you all the best for the remaining of 2020. We are nearly over that. And best of luck with a lot of solidarity and love in 2021.
Thank you.